Trowers, and today we'll be injecting my physician's assistant Jentry with some hyaluronic acid as well as a little bit more of a toxin. So when you look at Jentry, in part because she's in such great shape, you can see that she's actually lost a little bit of volume in her face over time. And where she's lost that volume is a little bit underneath her eyes. And then as she's lost that volume, it's kind of drifted down a little bit, and that forms that little bit of that depression right here. Now, you don't want to get rid of that depression 100% because you don't want to look like an alien, and we like her to have a very natural look. The other thing that we're going to do is put a little bit of a toxin around her eyes. So when you look close, if she doesn't smile, you can see that there's this little bit of lines right here. And basically that's because those lines over time get engraved into your skin from normal different facial expressions. And then when she smiles hard, you can see these lines that she forms on this side as well as on this side. So by doing the Dysport in those areas or any other toxin, we actually can help to relax those lines, as we've shown in our previous video of a before and after of toxins in her forehead and glabella. But now we'll show that change around her eyes as well. So I've already used some numbing cream on her, and so I'm just going to go ahead and inject. Sometimes you can hear a little bit of a snap, crackle, pop sound, and it's just the sound of the filler going through the syringe. So you can just tilt your chin down because we're going to get all the effects of gravity. We're also going to do a little bit of filler in this little line that she has right here. So you can just tilt down your chin a little bit more. Good. So you're just going to feel a little pinch here. Okay, so we're back. We decided to take a little break from the filming just because it's pretty time consuming to do the filler underneath the eyes, because you need to have a really artistic eye in terms of getting it just perfect because we want it to look completely natural. So you can see now that we filled in underneath Jentry's eyes that depression that she had there, and we also filled in her cheek as well as the nasolabial fold that's right here. And where you can really see the difference is if we just hold this up, you can see on this side before, you can see the loss of volume underneath her eyes, which kind of pulls her cheek down. The loss of volume here, which has caused the little bit of an engraved line over here, as well as the little bit of loss of volume in the actual apple of her cheek. But when you look on this side, you can see that we filled in this depression. We filled in a little bit of her cheek to lift it, and we filled in the nasolabial fold. She's just a little bit swollen and red, and it just looks a little whiter there from the numbing cream. But we're going to go ahead now and do the other side. The other difference that you can see is if you smile for me and show your teeth, you can see even over here, just seeing the apple of her cheek, how much smoother it is here, and also that she doesn't have that depression underneath her eyes. Okay, we're going to move over to the other side, and once we complete that side, we'll come back to shooting the video. So we've now completed both sides of Jentry's face. You can see that we've replaced the volume underneath her eyes. So if you just don't smile for a second, I know you're very happy because it does look great. But if she doesn't smile, you can see that we filled in underneath her eyes. She's just a little red and a little swollen with a little bit of pinpoint bruising, but that'll all go away. And you can see we smoothed underneath her eyes as well. And then we lifted her cheeks on both sides, and we softened the nasolabial fold. And I put a little bit in her chin on this side. So we're going to go ahead now and just do the Dysport around her eyes, and then we'll be seeing you again at the time of Jentry's follow-up in 2 weeks, or you can come see her here at the office. Thanks. Hi, we're here with Jentry, my physician's assistant, for her 2-week follow-up for her toxins and fillers. So how did you do with the treatment?
I did really good.
Good. Did anybody notice?
I did have an encounter. I have a neighbor at my building, and I always take my dogs down the elevator, and he saw me in the elevator and asked me if I had a good weekend because I looked well rested.
Okay, great.
So,
well, that's what we like to hear. We don't want anybody to know that you had any filler done. We just want them to think that you look really good naturally. So if we take a look, we had started off by doing some toxin around Jentry's eyes. So if you look here, when she smiles, you can see that we basically eliminated those crow's feet around her eyes. So when she smiles now, it's completely smooth in that area. So that's exactly the effect that we wanted. And then we're also going to show you on the other side. So you see this was her before, and so if you smile hard for me, you can see that all those lines on the side of her face were basically eliminated. And that will take effect for approximately 3 to 4 months. And then when you look at her smile overall, when she smiles hard, you can see that we eliminated those lines around her eyes, and it also softened it underneath her eyes as well. And then as we had stated at her first treatment, that because Jentry's in good shape, that she lost some of that volume in her face underneath her eyes. You can see here when she's not smiling, if you just turn your head to the left a little bit, you can see how she lost a lot of volume underneath her eyes, which gives her that appearance of dark circles. So by using the hyaluronic acid, which is the man-made version of what's naturally in your skin, you can see that we filled in this indentation on her cheek. So now she just has that smooth apple of her cheek in that area. And then when you look at her overall, you can really see how she had those dark circles underneath her eyes from that loss of volume. And basically with that loss of volume, it falls forward, and that's what causes the folds here, the nasolabial folds. So we filled in her cheeks here as well as underneath her eyes, and we filled it in on this side as well. And you can see that it just really gave her a more fresh look to her face. But very natural so that nobody knows, which is exactly what we want. Great, so thank you so much.